Podcast 6 of the Upper Limb series, the Cubital Fossa. This podcast is going to detail the Cubital Fossa, which is an important space that lies anterior to the elbow joint, and it contains numerous structures like tendons, arteries, veins and nerves that pass between the arm and the forearm. So the Cubital Fossa is positioned on the anterior surface of the elbow joint and represents a shallow depression. It has a roof, a floor, a superior border, a lateral border, and a medial border. The superior, medial, and lateral borders make it triangular in shape, with the superior border formed by an imaginary transverse line between the medial and lateral epicondyles of the humerus. The medial border is formed by pronator teres, whilst the lateral border is formed by brachioradialis. The roof of the cubital fossa is formed by the bicipital aponeurosis, which extends from the biceps brachii tendon and runs to the fascia overlying the flexor muscles of the forearm. The floor is formed by brachialis and supinator muscles, which overlie the distal end of the humerus and the elbow joint. The cubital fossa contains 5 structures that pass between the arm and forearm. These are the brachial artery and its accompanying veins, the biceps brachii tendon, and both the median and radial nerves. All of these structures are surrounded by a variable amount of adipose tissue. So let's detail these structures within the cubital fossa in a bit more detail, focusing on their relation to each other. It is easiest to relate the structures in the cubital fossa to the brachial artery. This artery enters the cubital fossa from the arm, where it is a continuation of the auxiliary artery. It enters the cubital fossa in between the biceps brachii and brachialis muscles. Once within the cubital fossa, the brachial artery is positioned centrally, with the biceps tendon laterally and the median nerve medially. This is an important arrangement to be aware of when taking the brachial pulse. You can palpate the biceps tendon by asking the subject to flex their elbow against resistance and feel for the biceps tendon. The brachial pulse can be palpated by pressing medial to this landmark. As the brachial artery passes through the cubital fossa, it divides into its 2 terminal branches, the radial artery, which supplies the lateral structures in the forearm, and the ulnar artery, which supplies the medial structures and deep structures in the forearm. You can remember the order of structures in the cubital fossa by using the acronym TAN. So from lateral to medial, T stands for the biceps brachii tendon, A for the brachial artery, and N for the median nerve. Running in the lateral part of the cubital fossa is the radial nerve, and this is found between the brachioradialis and brachialis muscles. In the subcutaneous tissue that makes up the roof is the median cubital vein. The median cubital vein is separated from the underlying brachial artery and median nerve by the bicipital aponeurosis. The median cubital vein runs transversely across the cubital fossa and receives the cephalic and basilic veins that are draining the hand. The superficial position of the median cubital vein makes it a useful site for transfusions and blood sampling. However, a misdirected needle can lead to median nerve or brachial artery damage. Like the structures in the axilla, which are vulnerable to damage when the arm is in the abducted position, the contents of the cubital fossa are vulnerable when the elbow is flexed. So in this brief podcast, I've detailed the boundaries and contents of the cubital fossa. In the next podcast, number 7, I'll look at the muscles of the anterior forearm.